Good morning, good afternoon, good evening, everybody. I am expecting Dr. Amaraki here as our guest, but for some reason, there's some struggle on her end. I'm so sorry about that. But I guess everyone is here now. I can see Sheila is still on. I'm gonna start our presentation, and hopefully people, as they hop on, I'll see what they are writing and I'll be answering whatever questions you guys have. This is gonna be like 45 minutes or so presentation, and hopefully we'll be able to say everything we need to say here. And I'm so sorry, I don't know what's happening on Dr. Amaraki's side, and she's trying her best to connect. I'm not sure why it's not coming through. So thank you so much for joining us. I'm Dr. Unati. I'm the host of Dr. M Health Corner page on Facebook. And I also host a few groups on Facebook. Right now, my focus is on one that I just found recently, and it's taking off. I can see parents are quite involved. As a Black mom, as a Black physician who sees quite a bit of Black children, I thought it's about time to go public and speak on places like Facebook, LinkedIn, YouTube to bring awareness to our parents. So I formed this group called Black Child's Mental Health Matters. So parents have been engaging, it's amazing, and the things we discuss on this group, they're just phenomenal. So we thought with Dr. Amaraki, we could bring on a topic that is of interest to many of you. And I know that people deal with these issues. Some of the parents I've seen or I've talked to, they don't know how to deal with these issues. So we're gonna talk about depression in children, specifically children, Black children. Of course, these symptoms are the same in all races, but as I said, this is for now specifically directed to Black children and Black parents, or parents that are raising Black children or mixed race kids. So quickly, I'm gonna go on the stats we have out there. We basically use World Health Organization stats, where there's up-to-date stuff posted by our epidemiologists, our doctors, really smart people involved in these stats, collecting these stats globally. So basically, in the world right now, the latest stats shows that we have 264 million people living with depression. This is the latest stats that came out late last year. And every year, there is 800,000 people dying of suicide. Suicide is also one of complications of depression. So that's quite a staggering number of people dying of suicide. And of course, even these numbers, we have the 264 million people with depression as the latest stats. That number is quite remarkable. I was actually looking at the stats of children or youth that actually in that 800,000 people dying of suicide, the numbers, mostly the age range that is common in that 800,000, it's 15 to 29 years. That's both males and females. That's something, right? As much as at this point, the only stats I could put reference to is African American children. I was also looking at their stats. There's a study that was done back in 1993 where they noticed that children between 8 and 11 committed suicide, or at that age group, there was high incidence of depression back in 1993. And that states those children that were committing suicide around that time in 1993, that range of children, they ranged at around 14th scale on the causes of deaths, but now it has gone up to 10th scale. So things are getting worse. We need to know why, and we need to empower Black parents or parents that are raising Black children. What is it that makes these children commit suicide? And honestly, I want us to actually pay attention to the fact that depression in children presents a little bit different from adults. A lot of times, parents would miss these symptoms because children, they don't necessarily present with the typical 2 weeks syndromic symptoms of depression, as we know in adults, the tiredness, the depressed mood. A lot of times parents miss these symptoms that I'm going to talk about shortly. Children with depression, if you notice that your child suddenly presents with irritability, your child is not interested in things that he used to enjoy or she used to enjoy, or you realize that your child is sleeping a lot, or maybe your child has short-temperedness, you notice that maybe somehow is also bullying maybe others in the house, or has become very aggressive towards his or her siblings, pay attention to those symptoms, because a lot of times that could be an ongoing thing, even beyond 2 weeks or even beyond 4 weeks. Sometimes parents just think maybe it's kids. You know, a lot of times parents always think that kids are just playing, or the kid is not listening, or the kid is defiant. Those could be actually red flags of something underlying. All right. And as we know, depression, like I said, now on the stats on World Health Organization, we're hearing that the stats of these young people that end up committing suicide, in that 800,000 people, the age range that is common in that 800,000 people is 15 to 29. So there's trouble there. So how do we identify these symptoms and this age group, more especially, like I said, in the Black communities? There's been so much challenges. One, there's a lot of myths around mental health illnesses in the Black communities. And the sad part is even places that hold numbers of people, somehow there's been some misunderstanding on this concept, like churches. The study I was looking at in America, there was a study that showed pastors that were interviewed, and they literally thought mental illnesses are for white people, which is not true. That's a myth, right? So the key thing is people need to be educated on this matter. And secondly, the studies show that it's always important to understand the cultural backgrounds of every race you deal with. And unfortunately, we have very few health workers or people that are trained in mental health. There's very few globally. It's a global phenomenon. There's very few mental health workers. People aren't aware. People are not trained. People are not, even parents aren't prepared, or they are not aware of these symptoms to be able to pick them up when they present in their children. So how do we curb, or how do we meet parents halfway in order for them to seek the help they need for their children? It's awareness programs, something like this, something of this nature. So I would like you guys to share this, if you can, with your friends, and also join our group. Like I said, on Facebook, we have a group that's called Black Child's Mental Health Matters. So I would like parents to come in, because we can only reach numbers when we all share these ideas with other parents. Like I said, again, depression in children is not as typical as a parent or an adult that would basically present with, I'm gaining weight, I have poor sleep, I just have no desire, and again, with children, we need to be careful. That's why we need to also take social history of children, the circumstances at home. What are the circumstances where these children are living? Now, actually, we're starting to recognize a link between your background and, of course, your mental health, even in adulthood. There's actually an institute in the States, the Permanente Institute, Kaiser Permanente Institute, that came up with a study in 1998 and studied actually university or college holding professionals. They have these college qualifications. They did a study on these people and realized that people that are at risk of depression or even diabetes or COPDs, there were some common factors that actually predisposed these people. One, we use a scale called Adverse Childhood Experiences. It's called ACEs. We're starting to actually adopt these ACEs, or these Adverse Childhood Experiences scaling, where we actually look at 10 factors that would actually affect a child between 0 to 18 years. And actually, unfortunately, these factors, if they're quite pronounced, they do affect a child even to his or her adulthood. First of all, we actually look at the history of this child. What was the background when he or she was growing, or where she's growing? Is there any mental health issues in the family? Any aunt, any uncle, any parent that has depression or bipolar or any other mental health issues, that puts that child at risk. Is there violence in this home setting? Any violence? Is this child violated by his or his parents or her parents or any adult that is looking after this child? Those are the factors that actually affect mental health. Or is this child witnessing violence? Is there any drug abuse in this family? Anyone went to jail, either a parent or an uncle? These are the factors that we actually ignore. And if you look at our families, all these factors I just mentioned, a lot of families have had these issues. Is there any history of sexual abuse? Any person who touched you inappropriately or did something, someone who was 5 years or who is 5 years older than you, it could be a parent, it could be an uncle, it could be a relative, it could be a family friend. That factor also contributes to how the child turns out. Right? So these factors is something we pay attention to because really they do affect. Somehow, like I said, your child could present with irritability, and this could be something that would actually make you aware or a red flag to sit down with your child. Why your child suddenly became irritable? Is there something going on? Like I said, go back to the ACEs, adverse childhood events. These events could actually affect your child's mental health. Is there anyone abusing this child? Is there anyone sexually abusing? And hence, probably that's why your child is irritable. That's why your child is presenting as defiant. That's why your child is suddenly, his or her grades are suddenly decreasing. The teacher is reporting to you that your child has become absent-minded in class. Your child has become isolating. She or he is isolating. Your child has no desire for school like he used to or she used to. Before you jump on by being reactive or being angry towards your child, stop yourself. Stop, think, and act. Sit down with your child. Recognize, hello, Dr. Yes, Dr. Lulu, thank you so much. Maybe there's bullying. And like I said, Dr. Lulu, she just joined us here. She said something about self-bullying. What if your child herself or himself doesn't feel good about himself or herself? And sometimes it could be indirectly a cause from watching his or her parents. How do you speak about yourself in front of your children? You now as a parent, what do you see in front of the mirror? How do you view yourself? Because our children mirror our images out there. I always say, my child is my mirror. He represents our home setting at his school setting. So we need to be careful how we present ourselves. That's one, bullying. Bullying is a major factor right now in pediatrics or in children that's causing suicides. We hear this all the time on Facebook. A lot of times there's a child that is bullied, either sometimes in class or by a teacher. This is the reality, guys. And sometimes by a parent, right? So that's why I'm saying you as a parent, you need to go back to your history. How did you grow up? Because you need the help that needs to empower you to become a better parent, because truly what we are as parents mirrors on our children. You need to go back to your ACEs if you had high scores, and a lot of times, a lot of people score 3 out of 10 or even more. And that actually puts you at risk of developing mental health issues later in your life, in your adulthood. So again, definitely check out this. It's called Adverse Childhood Experiences. It's ACEs, Adverse Childhood Experiences, right? These are the experiences a child would actually experience as a kid, like I said, between 0 to 18, and predispose this child to mental health issues, to diabetes, to COPD, things we never thought they would be related to how we were raised. I never thought in my training, in my own practice for 14 years, I honestly never thought diabetes would be related to your background as a child. So you as a parent, you need to go back and look at how you were raised. How is it affecting your parenting? How is it affecting your children? And stop being on denial. Stop being on denial, because like I said, I'm focusing right now to Black parents because we were fed a big fat lie in our childhood, realizing that mental health illness doesn't exist in our cultures, right? It does. We have the same brains as our counterparts. We have the same brains as white people, as Hispanics. And as a matter of fact, like I said, right now, the reason why I decided to form this group I was talking about is the realization that Black children actually have higher risk. Actually, it's the double risk of suicides. So what is going on? What are we missing as Black parents? What is it that we are not catching, right? So I'm gonna give each one of us here a challenge. Go back, Google it. Like I said, it's called Adverse Childhood Experiences. Go check out that chart, tick, 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 and see where are you? Where are you at? How is it affecting your being? How is it affecting your parenting? How is it affecting your self-esteem as a parent? How is it mimicking on your child, right? Because like I said, they are mirrors. How we parent our children, also it basically comes from how we were raised. It takes awakening. It takes conscious parenting to learn new skills. The mentality of mental health illness doesn't occur in black people is a myth. And unfortunately, you're gonna actually miss the boat. The realization is this is happening. And again, it's affecting a lot of our Black children. We need to be awakened. We need to learn new ways of parenting. I know that a lot of times, I'm South African. Where I was raised, this is not even about my own family only. As a Black child growing in Africa, I'll put myself generally as a Black African child. First of all, we are raised to listen to our parents, which is great. Every parent wants that. But in Africa, there's a lot of dictatorship parenting, where a parent has spoken and nothing goes afterwards. Guys, it's killing children. It doesn't work in this current parenting. In this era where we are raising our children now, that parenting where there was dictatorship, where you had no say, your parent had said it, and that's it. It doesn't work. You are indirectly telling your child to be mute. You are indirectly telling your child to have no voice. This world needs people who have voices. We need our children to be vocal. We need our children to stand for themselves. A lot of times, children that are bullied, a lot of times there's issues back home. There's dysfunctionality. I posted in our group that if you realize that there's family discord, you are going through divorce, you are going through separation, you are fighting all the time as a couple inside, and the children are watching all that, there's violence, there's drug abuse, that affects children adversely. So you need to seek help if you're going through that. I know that relationships sometimes don't work, and it's said that unfortunately they don't work. We need to avoid parental alienation syndrome. It's big in families. When your relationship did not work out with your spouse or your partner, a lot of times when parents are fighting all these, the child support or the custody of children, this parental alienation syndrome kicks in. Parents start speaking badly of the other to children, start bad-mouthing the other parent to children. Children don't need that. We talk about, yes, Doc. We talk about how children between 0 to 18, their brains are still developing. Their brain, they're absorbing everything. A child's brain absorbs like a sponge. Whatever you say to a child, actually, I was listening to one neuroscientist who was talking about how the first 7 years of life of any child is programming. So if you program your child in that first 7 years, if you miss doing the right thing in that first 7 years of life, and I'm not trying to make you feel bad here, but I want you to realize that the first 7 years of life of any child, those years are vital. This is the time where children are watching. They are just watching. It's like a movie in front of them. They are watching and they are copying. They are a lot of times parents tell children, don't do what I'm doing. Do what I'm saying to you. It doesn't work. If you are a parent that does drugs, or you are a parent that is disrespectful to others, your child will become. Because where is your child going to learn the basic values of life, the fundamental things that a child needs to be socialized? A child gets all that from home. So we need to be careful as we are raising these precious gifts from God. We need to be careful how we come across. And like I said, we need to seek help. We did not choose our backgrounds. We did not choose our parents. We did not choose what happened to us, but we can choose the future of our children. We can choose the future of us to become awakened and conscious parents, right? And the mentality of that blackness of, I'm not going to listen to a child. Guys, it's killing children. A lot of times, children that are bullied at school, their self-esteem is already killed at home. Don't expect teachers to do your work. Teachers are there to embrace what you already put. Your seeds are important. Like I said, first 7 years of life, it's programming. It's programming. So how we present ourselves to our children, how we become, how we present ourselves to the world, our children are watching. How do you come across to that waiter? How do you come across to that taxi driver? How do you come across to your colleague that is a CEO? Treat people the same. First 7 years of life, children are learning. They are learning ways of life, socialization, how you come across, how do you speak of yourself, how do you view yourself. And I'm not saying that there won't be times where you will be down. It's normal. All these emotions, God created them for us to be sad. We need to teach our children that sadness, anger, fear, all these negative emotions should be felt by all of us equally. And again, before I forget, boy children, these kids have been put in a little corner, boxed in a little corner, because lately we are focusing on feminism. I'm a feminist, but why are we leaving boy children behind? When you're raising these empowered girl children, nowadays, women are in big positions, something that was not happening 50 years or 60 years ago. There were few women then. Nowadays, women are in power. Again, there's a lot of movements out there going on about gender equality. And I'm for that. I'm okay with that. But now the challenge I want to give you guys, what are we doing for boy children to be empowered together with these empowered girls? Don't you think that if we continue empowering girls, leaving boys behind, it's gonna grow and grow? And that's what's happening right now. But don't you think it's gonna contribute to all this domestic violence we are seeing? Because men will suffer from inferiority and superiority in complex. It's real. We need to empower, we need men and women to empower boy children. I know that at this point, we're focusing on girls, and it's because there's been so much trauma. There's been so much trauma on women. There's so much discrimination on girls, on women. I get that, but we need to empower boys too. This is the world that we need to change from the times that we lived 50, 60 years ago where women had no voice. That's okay. But we need to equally embrace these two genders so that they are both empowered to function in the system in healthy ways, right? And again, we need more Black professionals who know our mental health and our cultures, to understand so that they can speak the language to their people, to understand, and also to understand where these myths are coming from without judgment, right? Because a lot of times people, they judge other Black people about how they are resistant. It's what they know. So how are they gonna know if we are not coming out in numbers as Black professionals to empower our people to open their eyes to this? Because it's happening. But the challenge now, we have few Black professionals. And I'm not disputing the fact that people are already doing the work, but we need more mental health workers out in the ground. We need people out there to educate our people. We need campaigns. We need more exposure for our people to realize that we make or we break our children. Actually, when you look at US, I'll talk about USA next door. I'm in Canada. In US, if you go to jails, a lot of jails are packed with Black people and Hispanics. We need to cut this percentage. We need to cut these numbers. Why? It's because we have dysfunctional Black families. Our communities are filled with so much dysfunctionality. Again, go back to the ACEs. If you find those ACEs, a lot of times these children are growing in violence. There's drugs, there's someone who went to jail. What is it that we are not doing in our communities to empower each other? Because it is affecting our children. They have so much low resilience scores because even parents themselves are broken. Even parents themselves are broken. So is in Africa. In Africa, where I come from in South Africa, there's a girl child that is killed every day. Even more, not even one. There's so much violence in our countries. There's so much hatred for each other, right? And thank you so much, Dr. Lulu. She's saying something very important, talks about post-traumatic slave syndrome. Our history, guys, our history has contributed to what is playing in front of us. As we all know, the slavery where people were taken from Africa went to America. That's the biggest thing. That's the biggest thing contributing to the issues they are dealing with, those Black communities there. There's so much trauma that happened. People never healed. It's generational. But now we are here, we are empowered, we know it is our challenge, and also it is our responsibility. Those of us that know now, that have information and access to this information, it is our responsibility to empower and teach our parents and also our people in general, Black nation as a whole. This is how we're gonna improve. This is how we're gonna reverse this history that, because unfortunately, truly, we can't reverse it. This is how we're gonna move forward with a better generation, right? My heart broke when I looked at a child. I'm not necessarily speaking about a Black child, a child in Australia who was 7, bullied, even begging his mother for a rope to kill himself or for a knife. What is that? Very sad situation. And we see this all the time in our Black communities. And again, I need to emphasize this. In our Black communities, we sometimes underestimate. I know, Dr. Lulu, it was a very sad situation. I know Dr. Lulu is quite an amazing speaker when it comes to suicide prevention. We're gonna talk about your work shortly here when I'm wrapping up. Right now, the other challenge I want to challenge Black parents here on this platform. How much time do you spend with your child? Do you know your child? Do you know your child's interests? Do you know your child's love language? Do we know our children? Because it's very important. A lot of times, children today, they seek attention from outside. That's why we see the sugar daddies, the sugar mamas. Kids never got the love they needed from their own parents. A lot of times, children right now, they are raised by their grandparents. Of course, they have wisdom. I love that. But where are we involved? Are we involved in our children? I don't even want to start the topic of the infestation of HIV in our African continent, taking away young parents and leaving these orphans to be raised by their grandparents. That is another topic for another day, because that has something to do with morality a lot of times. That's another topic for another day. We're going to talk about that because it has also actually flooded in our continent. It is affecting parenting because parents aren't there to raise their children. They're dying prematurely. Yes, in Africa, there's countries that have lifespan of 45 years. Who is raising these children? Grandparents will die. And then you wonder why there's child, marriages. There's so many factors. This is a multifactorial issue, guys. It's a multifactorial issue, but right now we need parents, Black parents, that will say from today, from this talk, I want to be an empowered and I want to be an awakened, conscious parent. From today onwards, it's never late to change. It starts with you. How do you view yourself? And seek the help you need. Depression, by the way, it is treatable. It is. It becomes a vicious cycle, of course. Depression is treatable. That you need to know. If yourself, as a parent here, you realize that you are sad, a lot of times for a period of 2 weeks, you are down, you are depressed, even the suicidal thoughts are coming, they are invading your mind frequently. You have become less motivated, you are feeling guilty, your self-esteem is so low, right? If you are a person who drinks, you are drinking a lot more. All of a sudden, you are experimenting with other drugs. The choices that you are making, the people you are hanging out with, right? The way you feel about yourself. Suddenly, you don't go to work, you submit a lot of sick notes. And unfortunately, the workspace today, there are no bosses or human resource people that are ready to identify the social deficiencies of their staff. What happens? You become fired. And then it becomes a cycle. You become a problem in the community where you are, right? So if you realize that you are experiencing these symptoms and they've been ongoing for 2 weeks or longer, seek help. Go see your doctor. I want us from today onwards to realize that we have the same brain cells as our counterparts. The white person and the black person has the same brain. We were created by the same God. So they experience the same emotions we do. Why do you want to suppress the feelings of sadness, the feelings of suicidality, the feelings of anger? Because unfortunately, these feelings, they manifest in other parts of your life. They manifest in your parenting. You become an impatient parent. You become an abusive parent. This is a vicious cycle, as I said, right? Because a lot of times, if we don't recognize these symptoms in our own bodies and we don't seek, it becomes a cycle. So if you realize that you have these symptoms, please go see your doctor. Depression is treatable, guys. And I would love Black people to view depression as diabetes, because here I have 19 guests. Maybe 1 or 2 or 3 of you has high blood pressure, diabetes. And I'm pretty sure you speak of those diseases freely. We need to come out and speak about mental health issues freely, like we do with other diseases, because this is the only way we're gonna curb the myths we have in our communities. We need to speak up about these conditions. Depression is treatable. Minimum period of treating depression is 6 months, and sometimes you need to go longer. That's okay, right? And mental health issues are as important as physical needs. Seek help, speak. A lot of times, Black communities have not been told to feel their emotions. Feel your emotions, go see a counselor. Like I said, you did not choose your past. If you were a child and you were abused, you experienced those ACEs, you were a child. You didn't choose that life. But unfortunately, it affected you. It's affecting you. It's affecting your parenting. It's affecting your relationships. It's affecting your spouse, your relations at work. This becomes an extensive phenomenon. So please, guys, seek help. Seek the help you need. Identify these symptoms I talked about in your children. And then again, before I forget, kids, sometimes there's pre-existing other conditions, mental health issues. Sometimes children have an existing ADHD, attention deficit hyperactivity disorder, or your child has autism, right? Or your child was exposed to alcoholism. Maybe when you were pregnant, if you're a mom here, you were pregnant, you drank alcohol out of stress, or maybe there is alcoholism, there was alcoholism, existing alcoholism while you were pregnant, you continued drinking. That affects your unborn child. So these are the conditions sometimes could coexist, and your child could have these conditions like ADHD could also coexist with depression. So before you jump and become reactive when you're dealing with your child, thinking your child is defiant, your child is not listening, stop and think. Observe these symptoms. Seek the help you need. And a lot of times, my culture, people, because they are so scared to talk about mental health issues, it's always about what would people say about me? What would my colleagues, what would my friends say about me? This is about your child. And I want to tell you this, it's even more common now in middle and upper class families. A lot of mental health issues there. A lot of times people thought these are issues of people that are poor. No. Depression actually is affecting every class because stress is stress. And I don't want to underestimate the other factors. Now I've been dwelling more on the psychosocial and of course, the social situations. There's biology. Sometimes there's hereditary situation here. What if? And again, as a Black person, we don't know our family histories most of the time. You don't know if you had an uncle that was depressed or you had a grandmother that was depressed. So there's also a genetic component. There's also a genetic component that could contribute to your child feeling depressed or yourself feeling depressed because this is generational. So there are also causes that are genetic in this situation. So pay attention to your family history. We need to start learning our family histories, not only our clan names, we need to pay attention to our health. And again, it's lacking somehow in our culture because there was no family history. In fact, a lot of times our Black people, they go to a doctor when they are sick. This is another topic for another day. We're gonna talk about teaching each other prevention because right now, we should also match the lifespan of our counterparts. Where I am, a female lives up to 86. A male lives up to 82 or 84. In the African space, we see people dying in the 40s. In South Africa, where I come from, the lifespan is 62, 64. We need to bridge the gap. We need to bring up that 20%, that 20 years. And a lot of times our people are dying with these mental health issues undiagnosed, not even aware they existed. I don't even want to go on the other mental health issues like schizophrenia, where there's so much myths and cruelty that goes on to those people because of lack of knowledge. Ignorance plays a major role in our Black communities, a major role. That's why I'm saying those that are empowered today, leave this space saying, what am I gonna do differently in my community? What am I gonna do to empower the next person? Educate someone who is ignorant. Remove the stigma. Thank you so much, Dr. Lulu. Remove stigma around mental health issues, guys. Like I said, a lot of times mental health issues, the biggest percentage, the chunk of contribution to these mental health issues, it's psychological issues. It's the brokenness in our families. We come from brokenness. We can only break this curse by making changes. Us now, we are empowered. Let us be awakened. Let us stop the mentality of, I was beat hard as a kid and it worked. Do you think it worked? Do you think we'd have the anger we have right now in the world? Because I know that a lot of times we think, and I'm not trying to criticize how we were raised. Our parents did what they knew, but we could do something different here. The mentality of, I'm gonna spank my child and I'm not gonna listen to a child. And the mentality of, in our Black families, that we do not give our children a chance to speak and explain themselves. Guys, it needs to end. When you do not let your child speak in your own small setup in your family, how is your child gonna speak out there for himself or herself? How is this child gonna ask for a raise? Why is a lot of people, even here, adults that are in the same job for 5-10 years, they have never asked for a raise because they were shushued as kids. This becomes something you grow into adult with. You were never given a chance to express yourself. You were never given a chance to express yourself. For me, I'm choosing to raise empowered, assertive children. I do not want to feel threatened when my child is challenging my statement. I don't. Actually, I brush his back because I want my child to be an empowered person out there in the world. But if me, as this person that teaches the world about talking, speaking up, and then in my house, I don't let my child, I can tell you that I have an 11-year-old that will challenge what I tell him. Of course, for me, those things will still creep in because that's how I was raised. My child calls me into order too when I'm off. And I do appreciate it. I do apologize when I'm wrong. I've learned that. We need to be a generation of parents that realize our weaknesses and admit them. Our children need to realize our shortcomings. Why is it difficult to say sorry to your child when you have wronged him or her? And then we wonder why children choose unavailable spouses, unavailable partners, because they were shushed as kids. They were never given a choice to make decisions for themselves. Now someone is making decisions for them in adulthood. They choose unavailable partners. They choose abusive partners. Guys, this starts at home. I do want you to be aware this becomes a cycle that gets into your adulthood in your choices. I do want you to realize that how our children become in adulthood is how we raised them. Did we give them a voice? Did we let our children challenge our statements? Do we apologize when we were wrong? Do we love our children unconditionally? I know that a lot of times also in our Black families, there's this trend of careers. I want my child. Did you pay attention to that? I want my child to be a doctor. I want my child to be a lawyer. Guys, stop it. It doesn't work in this generation of children. That's why I said in the beginning, do you know what your child likes? Have you ever sat down with your child and realized what he or she loves? We need to stop dreaming through our children. If we missed an opportunity in our own adulthood, we should not dream through our children. Let us empower children, embrace what they are good at. Some children are not academic. Some children would pick up, a guitar and be the best guitarist. We need to empower our children's gifts. This is a generation now. And pay attention to this. I am not underestimating education. I love education. I'm for pro-education, but I have chosen to be a parent that asks my child, what do you like? Because children thrive in choices they made. Once they realize the support they get from us as their parents, they thrive. Honestly, they do well. So this is a challenge to everyone watching here. From today onwards, remove your dreaming through your child. Let your child be and support his or her dreams, and you'll see the success that will come out of that. The things we listen at our offices, the things we listen to the children telling us that my parents don't understand me. My parents don't understand me, doc. My mom, my dad, no, they don't get me. This is common, guys, across board, like all classes, all social classes. This is a common occurrence. Like I said, this is about time we become an awakened generation of parents because we are cooking these deficiencies in our homes. I'm telling you the truth. An empowered child with personal power, who knows his significance in his home, who knows who's seen empathy and unconditional love, there is no way that child would be told by someone he does not see behind the computer to kill himself, and he does that or she does that. I want you to pay attention to what I just said. An empowered child, a child with an intact self-esteem, who knows who or she knows who he is or she is, will not get any instruction externally. If we had done our work as parents in our own selves, building our own self-esteem, knowing who we are, regaining our personal power, knowing who we are in our communities, in our work, in our personal space, in our partnership with our spouses, our partners, guys, there is no way that our children would be victims of bullying even out there. They will stand up. Bullying will happen. But studies show, you go and check this, studies show kids that are bullied, they've already had some deficiencies at home. There's some deficiencies, an absent parent, an absent father. Separation is contributing to this. Divorces, parent alienation syndrome. When it did not work out with your ex or with your spouse, make it work in terms of communication. Be the adult, be a mature, emotionally intelligent adult for the sake of your children. I always tell parents, there is no antidepressant. I know that parents, they jump and bring a child to a doctor. I think my child is depressed. Actually, the funny part, parents who do a lot of parental alienation syndrome, their children, of course, they present with depression because the child, by the way, your child loves you both equally. Your child loves his or her mother equally. Do not start trying to win your child towards you by speaking negatively about your ex. And then you bring your child to me as a physician. You want me to put your child on antidepressant. And I always say, I actually start with you. Before I even get to your child, how I consult, when I do my cognitive behavioral therapy sessions, I start with you. I start with parents. I want to know you. I want to see where you at with scoring high or low on your adverse childhood experience symptoms. Because a lot of times, all of us have experienced either there was single parenting. As Black families, where I grew up, in my country, in South Africa, there's a lot of single parents. Like I said, guys, we didn't choose our backgrounds. We did not choose our backgrounds. So I start with you. I deal with you. I help you. I empower you. I want you to visit that pain. I want you to visit that pain that has caused you to be the parent you are today. Because I'm not going to be able to help your child if I don't empower you. Absolutely, Sheila. If I don't empower you, how are you going to help your child? What we just talked about here, how are you going to put it into practice if you are broken? Guys, I'm here to talk truth to you because this is something that is preventable. We need to be vulnerable. We need to be vulnerable and get the help we need. We have such a painful history as a Black nation. We did not choose that history, but we can choose the future of our children by becoming vulnerable and seek the help we need. All right? As I said, when I empower a parent, the parents start waking up. Yes, this is my story. The parent, it's painful, guys, to visit those stories. I must say that. I need to warn you. It is painful to visit painful stories, but it brings healing and it brings awakening to your parenting. Yes, you become a conscious parent. For me, I can put your child on an antidepressant, but you will realize that I could increase the dose higher and higher, but your child doesn't change because you have not changed. The child goes back to the same stressor you at home. You are the stressor. You are the stressor because you have not dealt with you. I was looking at the studies that were recently actually released by Yale University. They looked at these kids that were anxious. This is how I adopted my style of practice, actually. They looked at these kids that were anxious. Parents were concerned about their anxious children. And this group of pediatricians and psychiatrists and neuroscientists, they said, you know what, let's deal with the kids later on. Let's deal with the parents. They started dealing with the parents. They helped those parents deal with their own anxieties. I always say an unhappy mom or an unhappy father produces an unhappy child. If we are unhappy ourselves, how are we going to have resilient and happy children? If we are bitter, we are angry, how are we going to have happy children? If you look at the pattern of kids that are bullies or of kids that are troubled, if you go back to the background and see the parents raising these children, you will see and connect the dots. You'll connect the dots. I'm not trying to make you guys feel bad. I'm not here to judge anyone. I'm here to say, let us be an awakened generation of parents. Gone are the days of this doesn't happen in African people. And we need to empower churches too, because I understand that faith plays a role in our being. It's part of who we are. It's part of what we know as an African community or as a people. It plays a role. But being in denial of your symptoms, saying you're going to be preyed upon, and later on you kill yourself, it's not good, guys. It's not good. I'm a Christian myself. I actually pray for my patients, but I'm also realistic. I'm also realistic of what my patients need. So I'm not here to downplay or probably criticize religions, and I don't care which religion you belong to, but seek help. Go and unpack the pain you had as a child, because it's affecting your parenting. You did not choose your childhood. You did not choose your ACEs. If someone is just joined here, you go and check out these. ACEs are called adverse childhood experiences. These are the experiences. Now we are using this scaling to look at why is it that there is commonality in occurrence of diabetes, of COPD, like chronic lung diseases, or mental health issues, alcoholism. It goes back to our past. How did you grow up? How were you raised? That you didn't choose as a child. You were programmed. You didn't choose as a child. So don't blame yourself and go around with fear and guilt and suppressing the pain you have experienced as a child. You need to visit that child, that little child that was ignored, that was neglected, is yearning for your love right now. That little child inside you, that little boy is sitting in that little corner. That little girl is sitting in that little corner, yearning for your love, yearning for you to pay attention to him or her, to heal, to become a parent, because it is manifesting in how you are presenting, how you are showing up to the world. In your parenting, in your relationship with your spouse, in your relationship with your coworkers, it's showing up because that little child is crying for you to go back there. You didn't choose it. You might be 40, you might be 50, you might be 60. Honestly, guys, suppressing pain, it manifests in other ways. It manifests in alcoholism. It manifests in depression. It manifests in how you relate with other people. You are probably viewed as someone who's difficult. You are viewed as someone who's arrogant. Sometimes it's because of how you were raised. Because like I said in the beginning, we as African communities, we were raised by parents, that generation that were authoritarian parents. You had no say, that was it. That's the generation we were raised in, and that's what they knew. Do you know what your mind tells you at that age? You tell yourself that no one is ever going to do this to me when I'm old, when I'm an adult. You probably have heard it in your children that when I'm old, this is what I'm going to do. Your mind, your subconscious automatically says, this is not right. And when I'm older, I'm going to choose better. And sometimes you don't. And then you become an arrogant adult. I do want to emphasize this. There's people that have very low self-esteem. They could be in positions and become very narcissistic. Actually, narcissistic behaviors or personality disorders, they are cooked at home. They are cooked at home. How you grew up. You had an arrogant parent. And this is how you viewed, like I said, your first 7 years of life, you are programmed. You are in programming. You are listening, you are watching your parents, how they are doing things. This is how we are. Right now, we are programming our children. The first, I always say, I give you the chance, 7 to 11. These are the times, very sensitive age group, to empower our children, to give them a stage in our families, a voice to speak up for themselves, to embrace their dreams, not to dream through them, to embrace and ask what they like and support their dreams, what they like. And let's be consistent. The love that was, conditional. You love your child better when he brought 98% on the test, or the mentality of hitting your child if he didn't bring 100%. Guys, you need to stop that. You are killing your kids' self-esteem or their souls. If if your child is an 80%, or if your child is a 50%, or is a 60%, what you can only do is to sit down with your child and help the deficiencies. Or if that is the best he or she can be, embrace it without judgment, without conditionally loving your child, because you are putting pressure. You are putting pressure on your child. And I'm not saying that your child, you cannot help your child in terms of improving, getting tutors and all that stuff. But sometimes some kids are a 50% average. That's the best they can be. Learn to ask, kid, this is what you got. What do you think of it? I like it, mom. Did you put your effort? Yes, mom. Fantastic. There's ways, guys, of wedding or of helping our children improve and be better. Because somehow your pressure on your child and your child seeing the disappointment you have on your face when he or she brings that 65% because you were expecting an 80 or a 90 could actually kill that child right there. Your communication with your child or your relationship with your child could end right there. The best unspoken words are facial expressions. Kids pick up those things. Kids are very intuitive. Your disappointment you showed on your face when your child brought 60% or 75% when you expected 100%. And sometimes you even became abusive emotionally on your child. These are the things, guys, I listen to every day in my practice. I saw my mom's face. I saw my dad's face who was just disappointed. And you lost your child that day. That's the day your relationship ended. It will be up to you for you to bring your child back from that shell by acknowledging how you spoke and your harsh words. Children are forgiving parents. Children are the most precious, forgiving angels. If you realized we were harsh when you spoke to your child, humble yourself. I feel good when I humble myself. When I have talked so much and I realized I'm harsh on my child, guys, I humble myself. I pull my child next to me and right away go back to that conversation and tell him where I went wrong and how I'll improve. This is how we become empowered parents, guys. Our children need to see our vulnerabilities. We need to humble ourselves. When we are wrong, yes, Dr. Lulu, our children need to see us cry. We have to cry. Why are we embracing only the positive emotions? Why do we want to laugh and share all these positive? Like I said in the beginning, our children need to see when we are angry. I do tell my child that when I'm angry, I do tell my child, man, I messed at work. Geez, that diagnosis, I missed it. This is how I am actually moving forward. He sometimes sees me reading my book. I'm like, you know what, son, I forgot A, B, C, D when I was helping this patient, and I'm bringing this patient back because I've realized our children need to see our mistakes. Our children need to see our vulnerabilities. This is how we're gonna raise empowered people, humans that will be resilient. This world is so cruel, guys. There's so much out there for our kids. There's a lot of dirt out there that is waiting for our children. Let us work together right here, be empowered, empower our children, be vulnerable, seek the help we need as parents, be more communicative and loving unconditionally on ourselves. Let's be compassionate on ourselves. Let's be empathetic on ourselves. We're gonna raise very empowered kids. Very few percentage of these children need medication. I need to emphasize that. And I don't want you to leave this place saying, I don't think my child will need medication. I want you to still listen to your doctor or your recommendations by your psychologist or a counselor. Very few. I've done psychiatry stuff, mental health stuff for 14 years now. And I've watched how my seniors managed these children. A lot of times children need reassurance and a changed and a transformed parent. Like I said, children are resilient. If we ourselves as parents understand our backgrounds and visit our pain, I'm mentioning this, both men and women. This is not a girl thing, guys. This is not a women thing. I'm talking here to fathers too. Visit your past. Visit that little boy that is sitting inside crying, yearning for that dad that was never there. That father that left your mother. That father that was beating your mother every day is yearning for love, your love, because probably that's how you are towards your spouse. That's how, actually, a lot of times people with low self-esteem, they move from one relationship to another because they are seeking something. They are empty inside. They are looking for something. And this something is not outside, it's within us. We can only be better when we visit that vulnerable, painful past. Visit that past. This is my request to all of us here. Visit that child that is crying. I don't care if you are a man here, you are 60, you are 40. Visit that little boy that was molested by an uncle. Visit that boy. Go and talk, go and share your story with a counselor, because it is affecting how you are right now. If you need to go make peace with that person, whichever way you're gonna do it, but you need to start healing. You need to start healing right now. And you'll see the pressure or the load that will go off your shoulders. You will see the hate you'll have towards alcohol, because right now, a lot of times, men, they don't visit their emotions. How they present, they become alcoholics. They become womanizers. They jump from one relationship to another. Guys, this is real. And these people, you'll find out they are successful in their their professional space. These are CEOs, but you wonder, why is this person jumping from one place to another? Why is he on wife number 3? It's the emptiness he's going around with. There's that little boy that is seeking, that is yearning, that is crying inside him. Till you visit that little boy, you'll continue moving, hopping from one relationship to another, or abusing your spouse, or abusing your children and the people around you. I'm not sure if there's any questions here, guys. I could speak and speak and speak about mental health. I have so much love for it because I love my people and I want to see a difference in African people, or anyone who is raising an African child. And right here, it's not about judging you. It's all about, we need to be awakened new generation of parents. We need to visit our vulnerabilities. We need to address our past pain. As a child, you never chose that pain. Visit that child. Visit that child. Visit that pain. Go and unpack it. It's painful to peel wounds, but it can only bring healing to your soul, and it makes you a better person, a better friend, a better spouse, a better partner, a better parent. Thank you so much for having me here. And I'm so sorry we couldn't get Dr. Amaraki, and I'm pretty sure next time we're gonna get her on, and many more other professionals here. If you really want to contribute to the world, please drop me either a message on my group, on the Facebook group. I said we have an amazing group. We need to grow this group. It's gonna be a movement. I want to see this group growing globally. The group we have on Facebook is called Black Child's Mental Health Matters. Black Child Mental Health Matters. It's a private group because we are discussing sensitive issues here. No judgment. Come and ask questions. I have amazing people in that group. I have pediatricians, Black pediatricians, Black psychologists, Black social workers, Black counselors, Black psychiatrists, Black doctors, Black parents who are so informed with parenting, who have done this over and over again and had produced resilient kids, and these parents that look back and say, you know what, thank you, I'm learning something here, and I could be a better grandparent. You know, the one thing I love about our culture, we are a very rich culture because we are very extended family oriented, and this should bring down mental health issues. We need to support each other. We need, because one thing about our culture is Ubuntu. Ubuntu means oneness, where we have that solidarity in our culture. That's one thing I love about being African. I'm so proud to be a Black person because our culture is rich when it comes to that. We empower each other. Let's empower this part of our lives. this part that we've been lied about, that it doesn't exist. It does exist, guys, and that's why our percentage is higher compared to the counterparts, because we were raised to believe that we have no emotions, and it's not true. So here, moving forward, I would love to hear people, men here, saying, for the first time, I went for a counseling session and I cried in front of that counselor. I want to hear those stories, guys, because honestly, no one is immune to pain. No one is immune to hurt. No one chooses to have these experiences. You were a child, you didn't know anything. Don't blame yourself, remove the guilt. Even if you found yourself, you were enjoying of these traumatic experiences, because that's what trauma does. It familiarizes you, and then you start enjoying it because that's all you know. Because as a growing brain, like I said in the beginning, it's like a sponge. We sponge everything, anything introduced to us, we are programmed. So remove guilt, remove self-hate. The other thing I forgot to mention is sometimes children, they start cutting when they are hurting. Kids that are cutting, they are not necessarily wanting to die. It simply means I am crying for help. I am crying for help. So try to identify these symptoms. You realize that your child, it's summer, he or she likes long sleeves. Not in a defensive way. Observe those signs. Your child could be hiding cuts. He is crying or she's crying for help. Sit down with your child, be compassionate, be understanding, and be loving. Don't judge your child. All it means is, mom or dad, I need help. And the reality is, children now, they are starting to abuse drugs. A lot of countries have all these different drugs. A child that abuses drugs is seeking attention. There's something lacking. Instead of you becoming a reactive parent, calm down in a quiet place, in a non-judgmental manner, sit down with your child and say, you know what? I'm sorry, I could not recognize your needs. That is that is utmost vulnerability. I'm sorry, I could not realize how hurting you were. That is accepting your responsibility as an adult to that child and bringing yourself to his or her level to say, I hear you. I hear you. It's time, guys, to realize that a child that is cutting, or a child that is irritable, or a child who is suddenly disrespectful, there's something more. There's something behind that. It's about time you become compassionate, sit down with your child and be as loving and be as non-judgmental and be as understanding, and ask your child, how can I be of help to you? It's very important. Seek the help you need. Rehabilitations are there to help your children. Nip it in the bud, because this could go further. We all know that children, or even people globally, people are dying of drug abuse, of overdose. Do not let your child to get to that point. We live in the world where now cannabis, like marijuana, is legal. Children have access to it. Guys, a child that is troubled, who has a troubled soul, goes to such things to nourish his soul, which is sad. It's not even nourishing the soul, because he wants or she wants to deal with the stress she has at home or the dynamics that are happening. And like I said, sometimes children cannot accept divorce, and it depends on how you are choosing to become as these divorced partners. It doesn't have to affect your children adversely. It's already a point towards the ACEs score, but it doesn't have to be as traumatic. Children are understanding. If you sit down your child, of course, age-appropriate discussion to let them know that the relationship didn't work, and work beautifully with your ex, respectfully, just for the sake of your child or your children. You will see how your child will become. Children are resilient and understanding. You have to move forward with a respectful mutual relationship with your ex. just to co-parent beautifully and healthily for the sake of your children. Your failed marriage or your failed relationship doesn't have to destroy the future of your children, because a lot of times children that are products of divorce, they swear, I will never be married. You have destroyed that child already, because most of the times it's a trauma they've observed. It's the anger they had seen, they had experienced or witnessed within you as parents. It doesn't have to happen like that. You guys could split peacefully. You could work out your things peacefully without involving your children, and rather work as mature, awakened, and conscious parents, just to build these kids' future, for them to also realize their own choices without being influenced by the past trauma experience from their own parents. Thank you so much. Again, I'm Dr. Unati. I'm on LinkedIn. You may follow me on LinkedIn. My name is Dr. Unati, Unati. Last name is Makiwane. I'm also on Facebook. My Facebook page is called Dr. M Health Corner. Dr. M Health Corner. I have groups there, few groups, like I said. Now I'm working on this Black Child's Mental Health Matters. I want to get more and more. I want to see that group with thousands of Black parents or parents raising Black children or mixed race children. I want to see empowered children. It doesn't matter which race, but of course I have focused on it because I'm Black. I really want to see a change. I do not want to treat your child with antidepressant because you are failing as a parent. I know that parenting didn't come with any protocols, but we can only be better parents when we are open to learning. No antidepressant will fix your child's stress because you are the cause of it. None. You can go to any book, go and research this. No antidepressant will fix that. That's why I always say I want to help the parent first to fix himself or themselves, to be awakened and to be a better person. Not even a parent, to be a better person. You will see the difference. You will see the love of yourself that will happen when you have visited those past wounds. Right? So join us on our Facebook page, Dr. M Health Corner, or join our group, Black Child's Mental Health Matters. This is going to be a movement, guys. I'm excited about it, and I can see the zeal parents have on there. It's great. It's amazing. And of course, I work with a lot of amazing people. I'm excited. I have here Dr. Uchenna Ume, aka Lulu, Dr. Lulu. Please visit her page, guys. Her page is on Facebook. Teens, can you please post it again, Dr. Lulu? Because I would love people to actually follow your work. Dr. Lulu is a pediatrician with over 30 years experience. She's just an amazing sister to me. We talk and talk. We have so much to get, in commonality together. We want to move and actually change the world for Black children. She invited me to her big first summit in her place. She lives in San Antonio. She's a Nigerian American doctor. She lives in San Antonio, Texas, and she's gonna do the first summit for teens, prevention of suicide. I'm excited about it. I can't wait to see it, and I can't wait to meet everyone because we need to make changes. So please, please follow Dr. Lulu. She's on Facebook. Can you please post your page, Dr. Lulu? Because I would love these guys to follow your page. Dr. Lulu is speaking every day on her page about teens suicide. You know, oh my gosh, she talks about everything, this lady. She talks about parenting. She's written books. And please post your books here. I want to tell people that she actually is an author. She's working on her 4th book right now. She has books on Amazon bestseller books. Please follow Dr. Lulu. She is on Facebook, Teens Live. Can you please write again, Dr. Lulu? I really want to share this because I would love people to see your page on Facebook. This one is just an amazing book. She just released a book that says A Teen's Life. Inside a teen's life. You would actually love reading the stories these kids share there. You could probably see stories that are identical to your own child, and she brings amazing experience and ideas and also advice on how to help your child who has such issues. So please visit her page, Dr. Lulu, Lulu, on Facebook. She's amazing. She's a mom to her 3 beautiful boys that are so gifted in so many ways, 2 at university, playing all different sorts of instruments and doing well in their school. And of course, his teenage son, who is quite involved also with her work. It's amazing. Her page actually says, ask Dr. Lulu. Ask Dr. Lulu. Okay? Ask Dr. Lulu. ASK Dr. Lulu, Lulu. Please follow her, guys. And thank you so much for joining me. We'll keep having these talks. I'll bring other speakers here, and I'm hoping Dr. Maraki could work out next time. We have so many other topics here we want to deal with. We want to talk about ADHD in children and also the myths around them. We want to talk about extensively on drug abuse. We want to talk about gender issues. We want to talk about everything, guys. I have amazing people on the page that have rich knowledge on these. They work with these children. I would love to see a difference in Black communities, or any parent raising a Black child or a mixed race child. Kids deserve to have the best childhood. Thank you so much for staying with me. Take care.